Okay, and here we go. All right, so let's go ahead and talk about a couple of other concepts. And I'm actually going to pass these medications around. And these are some of the common medications that we'll be using in respiratory therapy. This is something called acetylcysteine or mucimist. And you can see it has a little 10% on there. We'll talk about how we deal with percentages because that can be a little confusing. This is another kind of medication. This is Proventil or Albuterol. And you can see that this is a 0.5% solution. This is epinephrine. And you can see this is kind of weird. It says 1 to 10,000. Anyone ever heard of that? A 1 to 10,000 concentration?
Is it a ratio?
It is a ratio, and I'll tell you guys what that means, because these 1 to 100, 1 to 1,000, these ratios can be a little confusing. Okay. This is a medication that we will give a lot of here. This is albuterol, and this is the most common formulation of it. This is called a unit dose, and basically you just twist the top off there, and you can squirt the albuterol into your nebulization device. And you can see that it's 0.083%, and you will definitely be asked to convert that to milligrams. Yeah. And kind of a thing that I always remember is 3 milliliters of this stuff equals 2.5 milligrams. I just throw that in the back of my mind because that's a really critical thing to know. And then this is something called Liva Albuterol or Xopenex, and you'll give a fair amount of this as well. It's just 0.63 milligrams in this little 3 milliliter container here. So I'll just pass those around. You guys can look at them. You're going to be asked to do lots of different calculations with those kinds of medications. So let's go ahead and talk about percentages real quick. So what does percent mean? Out of what? Out of 100. Would you guys agree? Mm-hmm. Out of 100. So that's the first big thing that we need to recognize is that a percent is out of 100. So if I were to have a solution, and let's just say that solution were 1% solution. Okay, 1%. We'll start off simple here. 1%. That's something out of 100. Would you guys agree? And what 1% solution means is that I have 1 gram in 100 milliliters. If you've got that, and you know what I'm going to do is I'm just going to put that right up here. If you can run home to mom and you got this down, that 1% equals 1 gram in 100 milliliters, you're going to be okay. Converting percentages will be very easy now. So 1% is 1 gram in 100 mils. Let's say that I have that acetylcysteine or that mucimist I'm passing around. That's 10%. What does that mean? That's how many grams in 100 mils? 10 grams in 100 mils. So if I had 100 mils of that stuff, I'd have 10 grams of it. There's also a 20% mucimist. What is that? What is 20%? 20 grams in 100 mils. Would you guys agree? Okay. So is everybody okay in what percentage is? And just always think, 1% is 1 gram in 100 mils. 2%, 2 grams. 0.5%, 0.5 grams in 100 mils. It's always grams in 100 milliliters. Does that intuitively, is everybody okay intuitively on what percentage means? If you've got that down, you're going to be okay. You'll get through the rest of this. So, let's say, well, before that, do we generally deal in grams when we administer medications to patients? Will you receive an order that says, give 2 grams of mucimist to somebody? No. It's going to be in milligrams. So what we need to do to make it more convenient is when I deal with this percentage business, let's take that mucomist. Let's take that 10% mucomist, okay? 10% acetylcysteine or mucomist. Mucomist is the trade name. Acetylcysteine would be the generic. This is a problem that you're going to run into very commonly. You'll either see 10 or 20%. That's 10 grams in 100 milliliters. How many milligrams is that going to equal? 10,000, right? 10,000. It's actually going to be easier to convert this 10 grams into 10,000 milligrams. So 10,000 milligrams in 100 milliliters. Would you guys agree? Can I reduce this down further? Yes. All I have to do is knock out a couple zeros, and that's 100 milligrams per milliliter. 100 milligrams per milliliter. Now this is something we can work with. If we convert this 10 grams and 100, and we convert it into milligrams, we can work with this. This is easy to work with. So now, I go to my chart, and I see an order that says, give 250 milligrams of mucomist to the patient. And you pull out your little vial there, or wherever that vial is that's going around. And you pull out that 10% mucomist, and you go, how many milliliters of this stuff am I going to need to pull out to give my patient 250 milligrams? 2.5 milliliters, right? If I know, because 10% is 10 grams in 100 milliliters, which is 10,000 milligrams in 100, which is 100 milligrams per milliliter. Everybody's okay there? I know every milliliter is equal to 100 milligrams. So 1 milliliter is 100 milligrams, 2 milliliters, 200 milligrams, and then 0.5 mils is the 50 milligrams, or 2.5 milliliters. So I have made this calculation a lot easier for myself by breaking it down. So let's do one more. And you guys will have some to do on the homework as well. Let's now say that I have 20% mucomist. Okay, everybody's all right there? 20%. And I have an order for 500 milligrams. I want to give 500 milligrams of it. 20% equals how many grams in 100 milliliters? 20 grams in 100 milliliters. How many milligrams is that? 20,000, right? It's always going to be 1,000. You guys remember the conversion, right? Gram to milligram, run home to mom. So it's going to be 20,000 milligrams in 100 milliliters. Can I knock out some zeros? Yes, I can. Boom, boom. That gives me 200 milligrams per milliliter. Is that easier to work with now? Yes. So I want to get 500 milligrams. How many milliliters? Well, that's just 200 goes into 500, right? So 200 into 500. How many times does it go into 500? 2 times, right? 2 times 2 is 400. That gives me 100 left over. I can put a point here, though. Drop a 0 down. 200 goes into 1,000 how many times? 2, 4, 6, 8. 2.5 milliliters. So I'd pull out 2.5 milliliters of that vial to get to 500 milligrams. So does that make a little sense with percentages? So let's say that I have that albuterol vial. And it is the vial of albuterol, the little dropper that's going around. And it is 0.5% albuterol. I believe it says Proventil. We know that that's just a trade name. 0.5%. So that's 0.5 what? Grams in how many milliliters? 100 milliliters. 0.5 grams equals how many milligrams? 500 milligrams. Okay? So that's 500 milligrams in how many milliliters? 100 milliliters. Can I knock out some zeros? Yes. Boom, boom. That gives me 5 milligrams per milliliter. Do you see how simple that makes our calculating now? So if I wanted to give 2.5 milligrams of this 0.5% albuterol, that'd be how many milliliters? 2.5 milligrams would be how many milliliters? Half a milliliter, 0.5, yeah. So converting it down this way, working down to milligrams per milliliter, makes our lives a lot easier when we actually start calculating. And that is something that you probably are going to see on an exam, is it'll ask you, it'll say, okay, I have 0.5% albuterol, I have an order for 2.5 milligrams. That's a common, or what we call a standard dose to a lot of our patients of albuterol, even though haven't talked about albuterol. 2.5 to 5 milligrams, very common dose of albuterol. It will want to know how many milliliters of that do I need to squirt into the nebulization device, give to my patient. And breaking it down from grams in 100 mils to milligrams per milliliter will make your lives so much easier. It really will. Unless you're really good with math and it just intuitively makes sense. Okay. So that is a percentage. We're doing on time. Good. Let's go ahead and talk about proportion. Everybody saw the long vial of epinephrine there? And it said something like this, 1 to 10,000 epinephrine. I don't expect anybody to know what that is at this point, or what we use it for, or how it works. You might see something like this, 1 to 1,000, or 1 to 100, or 1 to 300, or 1 to 400, or 1 to 250.5. Probably not that, but you could. Let's talk about what this means. 1 to 1,000. Or 1 to 10,000, since we have that epinephrine there. So 1 to 10,000. If you see this, what this means is, this 1 is going to be, what do you suppose? 1 gram, right? That's generally the base, so grams. 1 gram per 10,000 milliliters. 10,000 milliliters. So that vial of epinephrine, 10 milliliters in that vial, and it says 1 to 10,000 on there, and that's telling us that if I had 10,000 milliliters of that, I'd have 1 gram of epinephrine. Let's go ahead and break this one down. So, 1 to 10,000 means that I have 1 gram, or how many milligrams? 1,000 milligrams in how many milliliters? 10,000. 10,000 milliliters. Can I knock out some zeros? Boom, boom, boom. What am I left with? 1 milligram and how many milliliters? 10. 10? Who has that vial of epinephrine? I want you to read how many milligrams in that 10 milliliter vial do we have? 10?
Repeat the question, I'm sorry.
How many milligrams are in that vial? What does it say on there?
There's 1 milligram
Per
10.
It works. Math works. So we got it right. We got it right. So 1 to 10,000 epinephrine, there are 10 milliliters there, and that's telling us 1 milligram and 10 milliliters. And you guys can see how I can simplify this stuff. And I know I heard somebody talking the other day that, oh, this proportion stuff's so horrible. Like, well, it is if you deal, but if we break it down, we can make it easier. All right. So we know that 1 to 10,000 is actually 1 milligram and 10 milliliters. Why don't they just put that? Well, they do. They'll put it right there on the vial for you. But in pharmacology, we have to ask you those questions anyway. So let's say that I have 1 to 1,000. That's a fairly common concentration. 1 what? 1 gram. And how many? 1,000 what? Milliliters. 1,000 milliliters. That's actually how many milligrams? 1,000 milligrams and how many milliliters? 1,000 milliliters. Can I knock out some zeros? What does that leave me with? 1 milligram per milliliter. Is that? No?
I don't get, why is it 1,000 to 1,000?
Okay, because I converted a gram to milligrams. Right?
Okay.
1 gram equals 1,000 milligrams.
Okay.
Does that make sense? And so 1 gram in 1,000 milliliters is the same thing as 1,000 milligrams in 1,000 milliliters. Does that make sense? It's the same thing.
Yeah.
Is that, got it? Okay. Okay. Let's do one more. And I believe this is an example they give in the book, a 1 to 100. You guys did the reading? Did they give you a 1? I think they 1 to 100, and I think it's talking about isopril or isopril. 1 to 100. So, what does 1 mean? 1 gram and 100 what? 100 milliliters. What's 1 gram in milligrams? 1 gram equals 1,000, I'll put an equal sign there, equals 1,000 milligrams and how many milliliters? 100. Can I knock out some zeros? Yep. Boom, boom. 10 milligrams per milliliter. So 10 milligrams per milliliter. So 1 to 100 is nothing more than 10 milligrams per milliliter. Is that, everybody okay there? Is that making sense? Okay. Heads north and south if it does. East and west if it doesn't. Everybody's okay? I haven't lost anybody. I'm glad you guys are asking questions though and get confused. Yes, sir.
I see we're talking 1 to 100. Will it ever be like 2 to 100 or 2 to 10,000?
No, you'll never see that.
Okay.
Never. It'll always be 1 to something.
Okay.
Yeah. Yeah, it'll always be 1 to something. Yeah. Now, if somebody were to be a real smarty pants and write 2 to 100, well, that'd just be 1 to 50, right? You could always make it 1. But you will never be asked that. I am never going to do anything crazy like that. Yeah. It's a good question, though. It's a good question. So hopefully that put your guys' minds at ease. I'm going to do another example. And let's see how you guys handle this. All right? Let's go. So now I have an IV bag. Everybody seen an IV bag? How much solution is there in an IV bag? Yeah, and the big ones. The typical, you have a liter. Okay? So I have an IV bag and it's full. And the nurse comes along and she injects, or he injects some potassium. You don't have to know why we would do that. But let's just say that there's some potassium chloride in there. And the nurse puts 10 MEQ. What's an MEQ? It's a milliequivalent, right? And you guys remember that from chemistry, milliequivalents? And it's actually, it's 1,000th of an equivalent. Equivalence is nothing more than moles times charge. That stuff in chemistry. Don't worry, I'm not going to ask you that. I'm not going to ask you moles times charge equals equivalent, and milliequivalent is 1,000th of the equivalent, but I'm not going to ask you that. But that's where that comes from. You guys remember from chemistry, right? When we talked about Avogadro's number and moles, and that's why chemistry is so important in respiratory therapy, because all those things come back to haunt you here. But let's just say, again, you don't have to know that right now. And when you are confronted with a question like this, do not let yourself become overwhelmed. If the question is asking you to calculate a concentration, just calculate. Just do what the question asks. Right? That's all we have to do. Don't get too wrapped up about all this crazy stuff if you happen to see that. I try to keep the craziness to a minimum in my questions. I try to be pretty straightforward, ask you straightforward questions. So let's just say that I have 10 MEQ, milliequivalents of potassium dissolved in this liter here, okay? And the physician wants to give 5 milliequivalents to the patient. So what is this question asking? This is asking how much of this IV bag equals 5 MEQ, right? Because the nurse put 10 milliequivalents in here, and the doctor wants to give, only wants 5, right? He doesn't want us to give a whole IV bag. He only wants to give 5 MEQ. So, are you guys confused?
I should give just half a liter.
So, yeah, let's make this simple. Do I have a concentration here? Yes. I have funny units, and do not let this confuse you guys. This is nothing more than a simple calculation. What this is saying is I have 10 milliequivalents, and how many liters? 1 liter, would you guys agree? And the doctor wants us to give how many of those 10? 5. And I simply have to know how many liters to give. Okay, so 10x equals 5. Divided by 10, 10 goes into 5 how many times? Well, 10, 5. It doesn't, so I have to drop a point there. 10 goes into 50 how many times? 5. 0.5 liters. So I need only give half of this IV bag. Half of this IV bag is going to equal 5 milliequivalents. So do not let craziness confuse the question. It's asking you nothing more than a conversion. It just has some milliequivalents in there, an IV bag. Doesn't matter. It's still a volume with something dissolved in it. Would you guys agree? And that's all that question. And you may see a question similar to this. Okay. Again, set it up like a normal calculation problem, because it's not asking you what the milliequivalents are or what the potassium is doing. It's just asking you to give that much. And in fact, if it would make it easier for you, you could even draw a little line through there and write milligrams or whatever, if it's that's confusing you. Obviously, you don't want your answer to be that. But if that terminology is confusing you, just go, okay, fine. I have 10 potassium. And that'll be okay, as long as the final answer turns out okay, which would be 0.5 liters. All right. Now, let's do, we have time. Let's do one more here. Let's say that I have a medication in units. You guys read the book? Did it talk about certain medications being in units? Okay. Boy, is that confusing. Or is it? Don't let the terminology confuse you. Let's say that I have a medication called heparin. Again, you don't know what heparin is, right? You don't know how it works. You don't have to. And in your homework, I have intentionally done a few things to get you guys used to. It just wants you to do the calculation. And I've written in some strange zoologologin or something like that. You have a gram of zoologologin. I don't know what zoologologin is. It's not a word. But does it matter? No, I have 500 milligrams of it, and I need to know how many milliliters to give. That's what I've done, is I've just thrown in these crazy just a strange word. You don't know what it is. We don't care what it is. We're just doing a dosage calculation. But we have heparin. It's a blood thinner, and we'll talk a little bit more about it when we talk about anti-thrombotic agents. And we'll talk a little bit about it in ACLS in a couple of years. And let's say that I have 5,000 units of heparin in 1 milliliter. That's a pretty standard concentration, 5,000 units in a milliliter. Okay. Don't get caught up by this. Don't get too confused. It's saying that I have 5,000 units in 1 milliliter, and that's all it's saying. And I want to give, let's say I want to give 800 units to my patient. How many milliliters am I going to need to pull out? That's what it's asking. So you can draw a little picture if you want. Have a little 1 milliliter vial, and in there I have 5,000 units. And I need to know how much of that milliliter to give. Well, I know that I have 5,000 units, right? In how many milliliters? 1 milliliter. I know that for a fact. Heck, you just gave half the problem away already. And I want to give 100, right? So 100 units on top. And I don't know how many milliliters to give. That'll be my X milliliters. So what do? Well, just cross multiply 5,000x. 5,000x equals 800. Everybody can see okay? Okay, I need to get rid of I need to isolate x, so I'll divide both sides by 5,000. X falls out. 5,000 goes into 800. Oh my gosh, that's a pretty big calculation, or can we make that simple? Knock out the zeros. Knock out those zeros, all right? So that gives me what?
8 divided by 50.
That gives me 8 divided by 50. Is that a little easier to deal with? Yes, so 50 goes into 8. Well, it doesn't. So what do I have to do? Put a point there, drop a 0 down. 50 goes into 80 how many times? 1. What am I left over? 30. Can I drop another 0 down? Sure I can. 50 goes into 300 how many times? 0.16 milliliters. So 0.16 milliliters equals 800 units. Again, don't let the unit, milligram, gram, don't let that confuse you. It's just asking for just a simple conversion. Okay, guys, that is it for the calculations and conversions.
How did we finish answering that though? Like, how do we pull that out?
Well, we'll talk about that later.
Oh, okay.
Because right now, I just want you guys to know how much to pull out. And then a little later on, we'll talk about actually putting a little syringe in the vial and pulling it out and measuring on the side of the syringe how much to pull out. We'll talk about that later. But first, we need to know how much to put in to pull out of that vial in that syringe, or how much to squeeze out in that little drop, or how many milliliters. Yeah. So once we get the math down, we'll actually talk about giving the medications proper. So, okay, guys, I'm going to go ahead and some of you have already printed the homework off. Mm-hmm. Some of you have not. I went ahead and just printed the homework out. Who needs it? If you could just raise your hand, I'll come by and. If you would, when you write your name, just kind of write it so I can read it easily.
I'm going to put your medication on too.
Okay, sure. Who else needs it? And if you guys want, I'll go ahead and just hand this out for you. If you guys want to start on it early. It's not due for, 3-4 weeks? So I'll go ahead and just hand these out. This is for the bronchodilators. Some of you have already completed. You've already completed.
Did you have one of those books at home, or did you? You do? You didn't bring it to class?
No, it's too big.
Like how big?
Physician desk, but then there's the little ones also.
Do you guys ever talk to the nursing students? Yeah. You know when the nursing students talk about having drug cards?
When they're nurses, they get.
How hard their life is to have drug cards. So now you can say it's a lot to do drug cards.
Yeah. You gotta come down.
I don't have to do that.
I was sitting down there, we knew we had to use the reference book, but we didn't know what reference.
Those are all the ones we had to write down.
The physician,
PDR.
yeah.
All right,
Do
guys?
they have that in the library?
No, you can use your textbook though. Your,
In here?
yeah, you can use that for some of it. You can go online. You can Google, just make sure that if you use online resources, that they're reputable resources. Wikipedia, probably not the best reference. Things like medicine, Hippocrates, micromedics are all good sources of information. Nursing drug guide, and we actually have some drug guides in the back here as well, if you need resources. Okay, guys? Do you guys have any questions for me? We have about 10